Good morning, everyone. My name is Michael Clegg, and I'm the moderator for today's session on migration and health. Well, that works better with a wine glass than with a water glass. So my name is Mike Clegg, and I'm here to welcome you and to moderate this session on migration and refugee health. We all know what an incredibly important issue this is for every country in the world. And we live now in perhaps having to deal with the biggest humanitarian crisis since World War II. We've assembled a group of 4 speakers who are knowledgeable in the area. They'll each give short comments of around 10 minutes or so, and then we'll sit and have a panel discussion. So our first speaker is Ambassador William Lacey Swing. He's on his second 5-year term as Director General of the International Organization for Migration, a post that he's held since 2008. Previously, he was UN Special Representative of the Secretary General for the Democratic Republic of the Congo, and in that post, he successfully led all facets of the largest UN peacekeeping operation in history. Before that, he served from 2001 to 2003 as a Special Representative to the Secretary General for Western Sahara and Chief of Mission for the UN mission for the referendum in Western Sahara. Through his diplomatic assignments in countries facing significant migration movements, he's acquired a deep understanding of the multiple factors affecting internal and international migration. Please join me in welcoming Ambassador Swing.
Good morning. What an honor, what a joy to be asked to take part in this very important summit. I want to make 3 points concerning the whole question of the place of health in the migrant and refugee global compact. First one has to do just with the nexus between migration and health. We're living in a world on the move. We're living in an era of unprecedented crises, unprecedented forced movement of people, unprecedented anti-migrant sentiment, and a period in which governments increasingly have lost confidence in their government's ability to address the migration issues and the migration opportunities. There are 1 billion migrants in the world today out of a population in the world of 7 billion. 1 in every 7 of us is a migrant, either crossing borders or moving within our own country. We would be, if we constituted ourselves as migrants, I'm a migrant myself, if we constituted ourselves as a nation, we would have a population as international migrants slightly smaller than Indonesia's, slightly larger than the population of Brazil. We would have a GDP roughly equivalent to that of a small to medium-sized European nation, with about $500 billion a year being sent home, only slightly smaller than all foreign direct investment in 2015, and twice the size of all foreign aid to countries abroad. So this is a major issue. Unfortunately, as I mentioned, 65 million of the 250 million international migrants are forced migrants, either refugees or internally displaced persons inside their own country. And so this would roughly constitute a population the size of France. So migration is a key element of our time. It is a global megatrend and is likely to remain so for some time to come. Now, all of these migrants have physical and psychosocial needs that need to be addressed both for their own sake, but also for the sake of their host societies. Health is, in fact, one of the most important components of an integration process. Now, we can argue that the stereotype is usually that migrants are coming to take advantage of our free public services. That may well be true, but we should, as government leaders and leaders of international organizations, be asking ourselves, Is it not in our interest that migrants have access to public health and public education? Do we want unhealthy migrants living in our communities? Do we want uneducated migrant children? Or do we want migrants who are healthy and well-educated, well-integrated into our societies so they can make their traditional contribution? We have currently a very toxic public discourse about migration, and we need to get back to an historically accurate public discourse on migration. My country and many other countries represented here today were built on the backs of migrants, and with the talent and brains of migrants, that's unlikely to change in the near future. So it would hardly be an exaggeration to say that healthy migrants are well-integrated migrants. The reverse is also the case, unfortunately. Unhealthy migrants are far less likely to become integrated and productive. So it is our shared responsibility as an international community to ensure that policy frameworks and programs offer health services equally sensitive to the needs of the migrants and to the communities in which they live. We need action now to ensure that migrants' right to health is upheld and that universal health coverage and equitable access to quality health services is given regardless of the migratory status. Migrant health is in the national interest. Second point, just a moment, the relationship between migration and the Global Compact. As you know, we held a summit in New York on the 19th of September on the large movement of refugees and migrants, and adopted there something that's now called the New York Declaration. This declaration addresses the two major global health concerns that have direct implications for migrant health. The first one is the reduction of socioeconomic and other disparities that create and sustain adverse health outcomes. The second one is very straightforward: the inclusion of migrants and mobile populations in all programs designed to manage or mitigate the global spread of disease. Now, if you look at the reaction that the world had to Ebola in the Mano River Union of Liberia, Guinea, and Sierra Leone, it was sort of twofold. One, it's way out there in Africa. It won't bother us. Keep these people where they are. And for goodness sakes, if they make it to our country, immediately put them in quarantine, even if they come from Kenya and South Africa, which are several thousand kilometers away. This was the immediate reaction. The same reaction has been that also to Zika. Instead of saying, mobility is a factor in health, we have to make sure that we treat it where it happens. And so we were asked to go in and run the Ebola Treatment Academy, the Ebola Academy in Sierra Leone, to set up the first Ebola treatment units outside of the capital, Monrovia, and to set up operations centers, emergency operations centers on the borders of Guinea, because disease moves. People are mobile. So we need to realize that in this interconnected, interdependent world that we have created, we have some responsibilities. So I think the declaration will help us to establish a framework that will protect the human rights of all migrants, including their access to health. It will strengthen global governance of migration, and it will support countries resettling, receiving, and hosting large numbers of refugees and migrants. You know, we've never really given credit that was due to the 6 neighbors of Libya and the 4 neighbors of Syria. These countries have all kept their borders open to help people who were fleeing terror and armed conflict at great cost to their own countries. When High Commissioner Gutierrez and I went down to the Libyan Tunisian border in 2011 after the fall of Qaddafi, we found 6,000 migrants a day coming across the border. They could have been bringing disease, because disease spreads. But the point is, we need to know these countries are really with us in trying to help, and they need help. They need monetary and other help when crises break out. So the Declaration of New York makes specific references to the health needs of migrants and refugees and commits us all to addressing the vulnerabilities of such problems as HIV and other specific healthcare needs. So there's a lot that remains to be done, and we think that the global compact that we'll be negotiating between now and 2018 will help us. It will be grounded in the Sustainable Development Goals. It will address migration from a holistic viewpoint. It will put migrants at the center of our consideration, and it will facilitate more opportunities for safe and regular migration. Final point is just migration and partnership. This is something we all have to do together to better understand the health aspects of mobility and to develop comprehensive programs of action. Concerted effort is needed if we're going to lift the profile of migrant health. We need to be promoting migrant-friendly health policies. Now, there's a good opportunity coming up, which is the second global consultation on migrant health that will be held in Sri Lanka in 2017, perhaps in the month of February. It will be shortly announced. There we have an opportunity to build a platform connecting health, human mobility, human rights, and equity in our globalized and interconnected world. Let me conclude by simply saying that the Sustainable Development Goals rightly identify migration as a driver and enhancer of sustainable development. SDG 3.8 calls for universal health coverage, and you cannot have universal health coverage if migrant populations and other vulnerable populations, mobile populations, have a restricted access to health services. Thank you very much to the World Health Summit for realizing the importance of the issue of migrant health and for inviting me to take part on this panel. Thank you very much.
Thank you, Ambassador Swing. Our next speaker is Florian Westphal. He is the General Director of Médecins Sans Frontières in Germany, and from 2010 to 2014, he was the Deputy Director for Communication and Information Management at the International Committee of the Red Cross. Previously, he worked for the ICRC in different communication roles, including in the Democratic Republic of Congo, Sierra Leone, and Kenya. He holds a master's degree in international policy from the University of Bristol and worked as a radio journalist at the BBC World Service and Swiss Radio International. Please join me in welcoming Florian Westphal.
Ja, soll ich einmal drücken, dann geht es los? Hang on. Sorry, I'm struggling with the technology. Drücke ich auf den falschen Knopf, oder? Okay. Okay, good morning, ladies and gentlemen, and thanks very much to the World Health Summit for giving me the opportunity to address this important topic. I will do so using the example of Europe and basing myself on the experience that we as MSF made in Europe, say, in the last 18 months or so 2015 and 2016. I will not talk about destination countries in Europe, so not so much about, say, Germany or Sweden and what happens in terms of healthcare for refugees and migrants in these countries, but rather talk about what happened and happens on European borders during the transit through Europe and how people's health is directly impacted by various policy choices. Now, I'm aware of the fact that Europe is in a way a very limiting example. 86% of the 65 million refugees and IDPs registered by UNHCR are actually in developing countries. Most of them are neighboring countries of the countries they flee from. Many of them, as you know, flee from war, from persecution, I should be saying, from other conflict-related problems. I could have also been talking about the Berm, for example, the area between Syria and Jordan, where 75,000 people are right now stuck in no man's land, not allowed through the border. No aid is getting towards them, and it's been like this for many months. And there seems to be no solution in sight, or at least no solution in policy terms that really offers any hope and support to these people seeking protection. But I'm also talking about Europe because we have a lot of direct experience from this crisis, because we worked for people and with people coming through Europe, arriving in Europe, and also because Europe really is a clear example of how policy decisions that have been taken do have a direct negative impact on people's health. So what am I talking about? Which policies? Not so much the policies pursued in individual countries. I'm fully aware of the fact that in Germany, for example, big efforts have been made, especially also by civil society, to welcome and look after the roughly 900,000 people who arrived here last year. But at the same time, we've also seen the EU and its member states, including Germany, pursuing policies that have been primarily aimed at keeping people out. Policies that are primarily aimed at deterrence, at closing borders, and that effectively have made it impossible for people to find a safe and legal route to seek protection inside Europe. Instead, these policies have led to people having no choice but to go through illegal channels, risking their lives on dinghies and rubber boats, which are clearly not seaworthy, and many people have died. As we know, this year alone, more than 3,000 people have died trying to flee from Libya towards Italy. So, in humanitarian terms, you may argue that the situation in Europe has somewhat improved compared to last year, and it would be fair to say so. But let us not forget that right now there are some 60,000 people stuck in Greece, practically no certainty about what will happen to them, often in totally insufficient conditions, overcrowded camps, insufficient healthcare, and an uncertainty about their own future, which weighs down on them. Meanwhile, as I mentioned, we still have thousands, sometimes thousands every day, who risk their lives on the journey from Libya to Italy in the hope of being rescued. So a brief recap of what we have been trying to do in the face of this crisis. I think if somebody had told anyone at MSF in early 2015 that we were going to be running one of our biggest humanitarian operations that year inside Europe, we would have not believed it. We've been active in terms of providing medical assistance to what are often called undocumented or illegal people inside Europe before, but obviously nowhere near this scale. What we've tried to do is, first of all, not make a distinction between people based on their legal status. At the end of the day, as a humanitarian actor, when you're addressing people's needs, the fact whether legally they may be classified as refugees or migrants is pretty immaterial. What you should be looking for are their needs and which ones need to be addressed most urgently. So we've also tried to really take into account the immediate medical consequences of what these people had experienced. The biggest group of refugees arriving in Europe came from Syria, so you can pretty safely assume that a lot of them have gone through very, very traumatic experiences, not only during their period of flight, but also in their country of origin. And finally, what we have done is we've repeatedly tried to point out what impact EU policies have had on people's lives. And at one stage, we've made the choice to no longer accept funding from the European Union or from its member states as a direct sign of protest against the EU-Turkey deal, which for us is the clearest example of these policies. Maybe let's have a look at Libya, and actually let's have a look at what people are fleeing from who are trying to leave Libya. We've been doing search and rescue efforts on the Mediterranean last year and this year. More than 100,000 people have tried to come across this year. I've mentioned the number of deaths. What is striking for our colleagues working on the ships is when they talk to people just how widespread the experience of being a victim of extreme violence and ill treatment is. So just a few figures from last year from one of our ships, 125 people were interviewed. 92% of them report having been a victim of some direct form of violence. 43% report having been taken against their will and held in detention in some sort of formal or informal way. I fear this is the reality of the situation that most of these people confront in Libya right now. And it's clear that the medical consequences are serious. So what are, hang on, I just want to make sure, there we go. What are some of the main physical problems that we have observed last year and this year? Obviously, these depend very much on the situation you meet people in, which route into and through Europe they took. I just want to draw your attention really to things like skin problems, for example. Last year, we helped some 3,000 people in the reception center in Pozzallo in Sicily. 39% of them had scabies. This matches with the numbers I've just given you about people held in detention in Libya. The two are clearly related. The fact is that these physical conditions are related, obviously, to what people have experienced in their countries of origin, but they're also largely related to what they experienced during their period of flight. Another example we can look at is Calais, the so-called jungle. Again, we see that the medical problems that we see there are linked directly to the poor living conditions in that camp. Overcrowded, insufficient housing, very little waste management are typical examples of that. And let's just bear in mind that of the 7,000 to 10,000 people who live there, 1,000 are unaccompanied minors, left exposed to these conditions. I just want to draw also a little bit of attention to the less visible medical consequences that these people bring with them, to the mental health impact. And again, it becomes obviously very tricky to immediately identify what the causes are. But again, what our colleagues who do talk to people and who do conduct mental health sessions with people fleeing into Europe observe is that not all the causes are linked to the situation in their countries of origin. Much of it is linked to the way they had to flee, to the experiences they made during their transit into Europe and through Europe, and to the uncertainty they now experience as they await being told about their future. We will be looking at the mental health situation also in some of the destination countries to actually see whether the mental health approach that we're pursuing in places like Iraq or like South Sudan, for example, may also hold some value for places like Germany and Sweden. Not obviously to replace anything like a proper therapy for somebody who needs it, but as a complement to the usual way of dealing with these kind of complaints. So, what is it that we are asking for? What are our demands? And I really want to call them demands because we are very insistent on them, and we believe that if the fate of the people arriving in Europe seeking protection, seeking safety, is to be at the core of everyone's concerns, which it should be, then these steps need to be taken. The first one is safe and legal passage for people seeking protection, and I want to highlight that again. We don't have that. If we're being told now that the EU-Turkey deal closes down illegal migration routes into Europe, that's somewhat cynical. There were practically no legal migration routes into Europe when this deal came into force. So what alternatives existed for these people? I've also pointed out here the importance of search and rescue mechanisms on the Mediterranean. A lot has happened, but still more needs to happen. For as long as hundreds, thousands continue to die, clearly it's not enough yet. And in general, we want to highlight that we feel that Europe needs to make true on its promises. Europe proclaims to be serving as an example to the rest of the world when it comes to upholding European values. Now here is an opportunity, here is an obligation to make sure that European policies actually reflect and correspond to these values when it comes to helping and supporting the most vulnerable and some of the most endangered people who are trying to seek protection in this continent. Thank you very much.
Thank you, Mr. Westphal, and thank you for the work of MSF. Our next speaker is Dr. Yves Dacourt. He is Director General of the International Committee of the Red Cross. As a former journalist, he joined the International Committee of the Red Cross in 1992 and worked in Israel and the occupied autonomous territories, Sudan, Yemen, the Northern Caucasus, and Georgia. He returned to ICRC headquarters in 1997 to take up the post of Deputy Head of the Division for the Promotion of International Humanitarian Law. In 1998, he was appointed head of the Communication Division and then Director of Communication in 2002, a post he held until his appointment as Director General in 2010. Please join me in asking Mr. Decord to come to the podium. Thank you.
Good morning. I must say I have a high expectation, not so much towards me, but towards you, if I may say. Why? Because I think we are possibly confronted with the biggest challenge that we as a humanitarian, and I would argue we as policymaker, we as government, we as academic, we're confronted with. I can predict you already that migration and health will be at the agenda of the World Health Summit for the next 10 years. So it's time for acting. It's time to look at solutions and finding ways. And I would like just to share with you a few elements and maybe one perspective. And take it as one perspective when you talk about migration and health. There are different perspectives. Take it one perspective coming from an organization, the International Committee of the Red Cross, working in very close physical proximity to people affected by wars, which means we are, in fact, right now in Aleppo with our colleagues of the Red Crescent. We are, in fact, everywhere you will imagine, in Afghanistan, in Yemen, in South Sudan. And it means we have a good understanding of what's happening in the country of origin, and that's what I would like to share with you. So the first thing we see, and that's not a surprise, but please keep it for you. Migration as a crisis will stay with us for the next coming years. Migration as a crisis will shape our political agenda. It is shaping already our political agenda. It will continue to shape it. It will shape our policies agenda, our practice. There is no doubt on that. Two examples, Syria. Florian talked about Syria. Ambassador Swing also. Syria, we know already that within Syria there is, 7 to 8 million internally displaced people. These people will be able to stay only if we give them the means and the minimum of security to be able to stay. And we know Syria as a war will not end tomorrow. So Syria will be with us for the next coming years. I can talk about Nigeria, northeast Nigeria, Lake Chad region. We see really a lot of people flying the region, and these people will have no other choices than possibly to go in region and maybe to move into Europe. So two examples which makes me understand that migration will be with us over the next coming years. And there is also, of course, not only conflict, but the economic situation around the world, and we see that in every country, the economic situation in the world is difficult, tough, so it will bring people to migrate. My second point, and I really would like to maybe to have a debate afterwards with you, is I do believe that the crisis in Europe has shown one thing, is that containment strategy, the idea that you can contain your problem far away, doesn't work anymore. That we are in a global world, we are aware of that, but thinking that somewhat you can build wall and hope that people will not come in your country is something which is short-term, but a long-term will not work. Containment, by the way, also, when it comes to health, is a disastrous. Thinking that you can contain epidemic or people in a country which are highly fragile are really problematic. So I think we need to recognize that not only migration will last as an issue, but the containment strategy will not be the unique response and won't make the trick. The third issue, and maybe this is the most important issues I would like to make, I think we've heard, and I think it's important, we've heard that when we talk about migration, we talk about numbers. We talk about, 42 to 45 millions of internally displaced people, 65 forced migrants around the world. We talk about 22 to 25 million refugees. We talk even in Germany about, 60,000 unaccompanied children. So I think these numbers are important. They give us the ability to grasp the magnitude of the problem, but they hide one thing. Behind every single numbers, there is a person. And when it comes to migration and health, specifically, You have to see the person. And I'm not saying that out of humanity only. I'm saying just that if you want to be able to understand the needs of the people, the specific needs of the people, women, children, communities, you need to understand who the persons are. What are their journeys? What is the problems? How is that happening? Think 2 minutes, if I take one example, about mental health. And it's why it's so critical to be able to talk about that today. Mental health, we all know, in Syria, but also in Iraq, we might be confronted with mental health issues which are of an almost epidemic proportion. If we want to be able to tackle that, we need to be able to see the person, to focus on the trauma. It's not just numbers. We need to be able to follow the needs very specifically. That's critical. Otherwise, we might lose 1 or 2 generations. And the pressure on our health system, including here, will just increase if we don't see the person. Seeing the person means also that you understand, and it was very interesting to hear what Florian Westphal, MSF, was saying, to understand the coping mechanism of the communities and the people along the journey of migration. And here, see the person is critical also to be able to understand what is the continuum of care along the journey. Some of you are professionals of health and you know how important it is to have an understanding of the continuum of care from the country of origin to the country of destination. And I would argue that we need to move beyond a notion of universal health coverage. There's a lot of discussion here, I think it's an important one, which focus mainly on system. We need to move beyond this notion of universal health coverage to the concept and practice of universal access to health. Universal access to health. Why I'm saying that? Because universal access to health is really focusing on the people. It's great to talk about system and health system, and we need to talk about that, but we need to be aware that in country of origin, one of the critical issues still remain today to just have basic access to health. And we need to grasp that. Otherwise, all our policies will not be able to capture what's happening really in some of these countries. So 2 things to have in mind. A, if we are talking about universal access to health, we need to make sure that the people providing health services, doctors, nurses, ambulances driver, volunteer of the Red Cross or Red Crescent, that these people, their facilities, their vehicles are not attacked, that they can do their job. And of course I'm saying that in front of you when you know exactly what's happening in Aleppo. And my problem is there is several Aleppo, not just one. If you would go to Yemen today, the level of destructions, the level of targeting of health facilities is just absolutely scandalous. If you go to South Sudan, you would see that the first facilities attacked are health facilities. If you go to Somalia, you would see that today being a doctor in Somalia is a very risky job. So we need to make sure that the people who are providing basic health service, when we talk about migration, can do so in the country of origin. Otherwise, it will become even more difficult. And of course, the second big issue when you talk about universal access to health is to make sure that along the journey, people, migrants, can then access health services which are available without discrimination. And I want to insist, without discrimination. Gender, religious, but also status. And that's a critical one. If we manage that, then I think we have a good chance to have universal access to health. It doesn't look very complex, but it's absolutely basic. So, ladies and gentlemen, I think the challenges are huge, and we are aware of that. That's also why, and I'm so happy that the World Health Summit decided to have these sessions to discuss, not just among us, but with you, with professionals of health, government, private sectors. And what I know is if we want to be able to find solutions, we will have maybe to take into account at least 3 elements. The first one, let's be humble. There is no humanitarian solution to political problem. So we will not solve Syria, Yemen, and the migration crisis. So this needs to be solved at the political level. It's tough, it's difficult, but that needs to be understood. Let's be precise on what we can do. Be continuity of care for people on the move. Refugee, migrant is key. But we need to ensure it really in every place, and we need that to do that in collaboration. And I think here we need to go beyond our missions and our responsibility. We need to reach out to government. We need to find solutions with private sectors. We need to really be aware on how do we map, in fact, today along the journey, the medical facilities, the services, and how do we protect also the data of the people. The data are central when you want to do continuity of care on health. And last but not least, let's remember when we as leaders are talking about numbers, they are important, they are key, they help us to design policy, but let's remember that beyond every number, you have a person. And we need to absolutely focus and see the person. Thank you.
Thank you, Dr. Discourse. Our last speaker is Helle Thorning-Schmidt. She is Chief Executive Officer of Save the Children International. She joined the organization after a formidable political career. Formerly, she was the Prime Minister of Denmark, during which time she led a coalition government from 2011 until 2015. She was elected when Denmark was in the wake of the impact of the financial crisis. She was a member of Parliament and a leader of the Social Democratic Party for 10 years. From 1994 to 2004, she was a member of the European Parliament and previously worked as an international advisor to the Confederation of Trade Unions. Throughout her career, she has tackled significant national and global issues, specifically with regards to children's rights. She's been recognized for her commitment to helping children fulfill their potential by ensuring access to quality education, and was invited by the UN Secretary General to be a global education champion to promote the Global Education First initiative. In September 2015, she was appointed to the Education Financing Commission led by Gordon Brown. As CEO, she oversees humanitarian and development programs that directly reach 55 million children in 120 countries every year, including some in the most difficult and challenging contexts. She's trained in political science and has a master's degree in European studies. Please join me in welcoming Helle Thorning-Schmidt. Thank you.
Good morning, everyone. It's a real pleasure to be here. It's a real pleasure to feel the mood in the room. And I really want to thank very profoundly the global health community for taking a keen interest in the questions we are discussing today. Thank you very much, and I look forward to the discussion we'll have with the panel. It's always special to be in Berlin, but also now that I'm working with Save the Children, it's perhaps more special than it ever has been. Because just a few miles from where we are right now, and nearly 100 years ago, Save the Children started our work here in post-war Germany. And what we did was basically to help feed hungry children. And it was the same humanitarian spirit that we were founded on almost 100 years ago, and the continued inspiration of our founder, which was a British woman called Eglantine Jebb, who founded us in 1919. And it is with that spirit, and in the midst of the global crisis that we are facing right now with the refugee crisis, that we have now returned to working in Germany with vulnerable children, refugee children, and we are doing that just a few kilometers from here in the Tempelhof refugee camp. Things seem to come back in the most sad way. And the scale of the crisis that we are seeing now, and I think that has been demonstrated from the speeches that you have had so far, the scale of the crisis is staggering. What we need to imagine is all these people. And sometimes when you hear the figure 65 million displaced people, as you have heard today, you have to ask the question, how many is 65 million people? And we have tried to put a picture on how many 65 million people actually is. And if all those people were citizens of one country, that country would constitute the world's 21st largest country by population. This is a country that will have roughly the same population as the UK. It's a big country. But what we also know, that this country, the 21st largest country, would rank 4th to last in terms of primary school attendance. And of course, in terms of health, we know that we would lose far too many children to diseases that could have been prevented. It would also be the country with the highest rates of child marriage. It would be the country that would have the fastest growing population in the world, and of course one of the youngest populations in the world. And it is their future that is at stake, their future that we are discussing today. Because if these people have to reach them with life-saving health intervention and opportunities, we have to change the way the world works. Right now, what we are seeing is that if you're a refugee or a displaced child, you are extremely likely to face serious physical and also mental health risk that could basically destroy your future. We have heard a lot about mental health today, and I want you to also not to leave without hearing it from us. This is a very serious issue. And it is that serious physical and mental health issues for these children that we need to change. Think of the children that you hear about every day. Think about the children still inside Syria, trying to flee the conflict or find refuge where you have deliberate attacks on institutions where children are every day. Deliberate attacks on schools, deliberate attacks on health facilities, deliberate attacks on health aid workers trying to help them. If we look at East Aleppo that we hear about every day, less than a quarter of the hospitals can operate now. We know that fuel for generators needed to just cover vital equipment is running out. And when airstrikes hit, patients are simply left to die. We have a population inside Aleppo of 300,000 people. We now have 35 doctors remain to treat that population. That tells you, who are the health community, a little bit about how horrendous the situation it is. And in these horrendous conditions, it is no surprise that disease is an ever-present risk. And on top of all this horror, these children have been facing deadly outbreaks of meningitis, and of course, with not enough hospitals, not enough health workers and humanitarian workers to help them in this crisis. Children and families who are then deciding to try to flee this situation often do not find that things will improve for them in their situation. They will face dangerous land and sea journeys. They will face, as we have heard, hostility. And of course, some of these children, also unaccompanied minors, are facing detention at border authorities. And of course, there's a constant risk of being exploited by smugglers and traffickers. I have met some of these children. I went to Greece in July. I went to one of the refugee camps that the Greek authorities run in Lesbos, and I spoke to the children. I spoke to the children who feel that they are in detention. And why do they feel that? Well, it might be that the Greek authorities are not calling it detention. But for the 15-year-old boys that I met in that camp, who feels that the whole day and the whole night they know that the door is locked from the outside, it sure feels like they're in prison. And they asked me very clearly, why are they treating us like criminals when we have done nothing wrong? And I ask you, the health global community, what do we think it does to these children? I saw them trying to learn English. It was actually a very touching scene because we run not a school but an education facility in that detention center. They were engaged, they were smiling, they were trying, and they were working to get a future. But if we're not letting them out of detention very soon, if we're not telling them where they're going to live now and in a few years, we will create lasting damage to these children and their whole future. We're stealing their future. And of course, we also know that these children are not getting access to the most basic health care that they should get access to. They have the trauma experience. They're not getting access to the mental health care they should get access to. And we also know that some vaccinations are not given to them. They have a very serious situation. And a response that aims to ensure children receive timely and quality health care, whether they're on their move, whether they're in the country that they cannot flee from, whether they're on different migration routes or entering and living in host countries and different settings, we need to ensure that response. And this starts with ensuring access for humanitarian intervention in conflict zones. In places like Syria, South Sudan, where humanitarian workers are trying to get access to these children, we know there can be a grave risk, and we need to change that. It also involves investing in resilient and high-quality local health system in settings where they have refugees. Someone was reminding us today that 86% of refugees are not in Europe. 86% of refugees are hosted in developing countries where health systems are already not working or very overstretched. What do we do for these people? And many refugee families, they have been on average displaced for 17 years. So we can imagine that the pressure that is put on developing countries and their health systems is quite severe. And that's why when we talk about health and displaced people and displaced children, we must also talk about developing a health infrastructure in the countries of where they are. Otherwise, we will continue to see far too many children dying from preventable diseases. How many are we talking about? Well, in 2015, we saw almost 6 million children lost their lives in this way. And we have a lot to do if we want to achieve the Sustainable Development Goals that the world have promised these children. What will this require? Well, it will require discussions like we have today, with a renewed focus on health facilities in developing countries where a vast majority of displaced children are living. It will require government to step up and increase development assistance to the development of health facilities, as well as also forging new and innovative partnerships with the private sector to deliver life-saving health innovations. What am I talking about here? Well, basically, I'm talking about us, the NGOs. We can't rely solely on governments or government funding for what we are doing. And one of the things that Save the Children are doing, actually with great success, is that we are forging partnerships with private corporations to create health interventions for children. An example, we have a strong and long-standing partnership with GSK. We're very proud of it. And with that partnership, we have reached over 1.3 million children with immunizations, treatments for diarrhea, malaria, pneumonia, and also screening for malnutrition. And I believe that these kind of partnerships will be part of what we have to do in the future. But we mustn't forget that we still have children who are on the move, and they need immediate care and protection. We need to greatly increase our search and rescue capacity. We need to help children that are dying at sea. We know that more than 3,000 people have drowned in the Mediterranean this year, 3,000 people. and more than 40% increase of the same period last year, and almost twice what we had in 2014. The number of children drowning every day on average is 2. 2 children die every day because they are trying to cross the Mediterranean. Everyone is trying to do their part. We heard what MSF is doing, and Save the Children have just launched a health and search initiative, and we have a vessel in the Mediterranean Sea. The first week we were out in the Mediterranean, we rescued 300 people, including a pregnant woman, unaccompanied children, and a newborn baby. We also need to provide children on the move with primary health care services such as vaccinations and psychological first aid in child-friendly spaces. This is what we do at our best. We create child-friendly spaces. And we also, of course, need to work with nutrition experts and health experts to make sure that this is happening. Some of the panelists have spoken about how it is incredible that we are now in a situation where organizations like Save the Children and Médecins Sans Frontières are working on humanitarian work within Europe. But I must say that even though it's a surprise, I'm very happy that we have been able to step up and do just that. In Germany, for example, a country that has taken a huge responsibility over the past 18 months, we are working in partnership to help refugee children by creating child-friendly spaces, pushing for minimum protection standards in refugee camps, and of course ensure that all children get the protection that they need and that they have the right to. And across the board, we need to do much more to invest in these children, make sure that now they are in Europe, that they get the health care that they need and can actually bring them a future. I'm very much hoping that the world will stop talking about children on the move, stop talking about immigration children, refugee children, and just talk about children. Wherever children are, they have a right to a decent health care. They have a right to simple things like immunization. They have a right to be protected. And we need to step up this conversation about what we want to do for the world's children. I'm very happy that you have taken an interest in this area. And I believe that together with you, together with our partners, together with health experts across the world, together with governments, we can do much more to help children not only survive, but give them that future that they so badly deserve. I look forward to our cooperation. Thank you very much.
Thank you for helping us to see this crisis through the eyes of the most vulnerable victims. So thank you. So we have some time for conversation, and I'm sure we won't have any problems maintaining our conversation. But let me start by asking Ambassador Swing, perhaps you gave the most hopeful statement when you talked about the New York Declaration. Could you tell us what the next steps are to make that declaration into policy and practice?
I guess I would quote our dear friend, Archbishop Tutu, "I'm not an optimist, but I'm a prisoner of hope." In some ways, the summit on the 19th of September and the summit on the 20th of September were historic, and that's a very much overused word. I use it advisedly. But it's historic in the sense of its uniqueness because it's the first time in the 71-year history of the United Nations that heads of state have gathered at the UN General Assembly to discuss the issue of people on the move, large movements of refugees and migrants. I think in many ways the summit came out of a sense of great frustration And it's interesting, and the former High Commissioner for Refugees used to say that it's only when the problem came to Europe that it came to the attention of the world. We have refugee amnesia. We have forgotten that my organization, IOM, and the UN High Commission for Refugees were founded in 1951 precisely to bring Europeans ravaged by the Second World War to safe shores and new lives. We have forgotten that Ethiopia has been host to 700,000 refugees, Kenya 600,000, Sudan 200,000, and today Turkey, the largest refugee hosting country in the world. Lebanon, with a population of 5 million, has 1.5 million Syrians, plus the 500,000 Palestinians who are already there. And water-poor Jordan, with roughly the same population, has an equal number of Syrian refugees. So I think that it was high time that such a meeting occurred. I was personally pleased that it had as large a participation as it did. Now, it's easy to criticize it because you could say, here we have an urgent issue, and all you do is call for a meeting in 2018. And yet, on the other hand, it's not an issue that you can solve in a one-day summit. And I do think it set in motion a process that offers us hope of coming up finally with some kind of a commitment to shared responsibility for all those people on the move for whom there is no international legal framework to protect them. Now, I'm not here this morning to press for another international agreement. I think it's unlikely we would get one in today's divided world, in this arc of instability that stretches from the western bulge of Africa to the Himalayas is unlikely. But it's high time that we recognize, very much as our brilliant speakers were saying, that these are people behind every statistic. These are children. These are mothers and fathers. These are people who need at least some form of temporary protection and a chance to hold on to life. I guess the most positive thing to come out of the European situation has been a commitment on the part of everyone. Top priority is save life. If you don't save life, you have no options. So what we have now is the new president of the General Assembly will shortly be appointing co-facilitators. We don't know who they will be to sort of run this whole process. Our organization, IOM, plus the UN Secretariat, have been charged with what they call servicing the negotiations as they go along. Clearly, the first part of 2017 will be used in trying to get the views of UN member states and others as to what should go into this compact on shared responsibility. Negotiations will begin, and unlike a chairman's summary or some kind of other paper document that goes into a file, there is supposed to be a negotiated outcome whereby we all commit to taking care of those people who are on the move, including what we talked about this morning, practical measures, turning detention centers into reception areas where children can be given proper care, giving migrants, I think very much as was said, not universal health cover, but universal access to health, as both in the interest of the migrant as well as the host community and in the national interest of a country. So all of this is sort of up for grabs right now. We'll be looking at two challenges in the end. One is, can we use this process leading to a global conference in 2018 to turn around and change the currently poisonous public discourse about migration? Migration has become a negative word. We're dealing with stereotypes. They're bringing criminality in. They're bringing disease in. And the cruel irony is that people who are fleeing terror and armed conflict are now being suspected of the same. This is how far we've fallen. So that has to be turned around, as I mentioned in my remarks, to come back to a historically more accurate understanding of migration. Migration is humankind's oldest poverty reduction strategy. So the second one then is to learn to manage diversity. Politicians today, very often, rather than helping people to deal with their fears about all these forced movements, are actually playing on the fears to gain political votes. So there has to be much more political courage and leadership to say that we're living in a world, if you look at the demographic imbalances, with a global north in demographic deficit, in need of workers at all skill levels, and a demographic south that is youthful and in need of jobs with a turgid rate of job creation, what other conclusion could you reach than that we're going to become inexorably more multi-ethnic, more multicultural, more multi-religious, and the smart money is on educating and informing people as to what is coming down the pike. And this really, I think, is kind of the context in which, I'm sorry for this overly long answer, but it's dangerous to give me the microphone. Thank you very much.
Thank you. Thank you for that recap of the U.S. presidential campaign. I really appreciate that. So perhaps, Hella, I could ask you, you talked about how the refugee camps don't provide services, create ill health, don't educate children, create a sense of imprisonment and mental health issues. The average residency in a refugee camp is somewhere over 10 years, 15 years, something like that. So now we're creating more and more camps. How do we prevent these camps from lasting for 15 years, from children growing up their entire lives in these camps?
First of all, I mean, I went to Greece, as I told you, and I went to the camp, and if one of you ever get there, it's very, very depressing. And in there, you have a section, I mean, it looks like a prison, and in there you have a section where the children live. They're supposed to be there 72 hours, where you find out where they're from and what their papers, and sort out what should be happening to them. But the boys I spoke to, they've been there for 3 and 4 months. And so more like 72 days, actually. And when I asked them, what do you want to do? And that's the amazing thing, and that's why they can't knock the hope out of me either. When you ask these children, what are you going to do? They all want to be doctors and engineers and professional football players and all the things that kids want to do. And the amazing thing that we haven't knocked the hope out of them yet. But the only thing they're asking, that they were saying this to me, they're saying, oh, we don't ask for to be nationals of any country, we just want to go somewhere where we can go to school and start a life. That's all they want. But I need to say this to you, that if these children are not out of that very, very soon, I am seriously worried about their mental health, but also that light that they still have in their eyes, that will be gone forever. And back to your question, it is possible to do things differently. Because with the help of ECHO money, actually, from the European Union, and we're taking ECHO money, with the help of ECHO funding, we have now, in Lesbos, made a little house. It's a house that we have rented, and in this house we have 30 of these kids living. That's where they can get access to education, they can get a life, they can play a bit of football and other things that they want to do. So I'm just suggesting that if you have the right funding and the right will, it is possible to receive these children in a different way and give them a little bit of an anchor and a hope for the future. So it is possible to do that with the right will and also, of course, the right funding.
the message I kept hearing when you spoke before and now is that children are children, no matter where they are, no matter what circumstance they find themselves.
Yeah, and the amazing thing, I mean, we know this because we have children and we talk to children, we love children, and we know that they have an amazing capacity to keep that hope. Mm-hmm. I mean, I was in, this wasn't a refugee camp, but this is in the darkest slum of Freetown in Sierra Leone. And you go into that slum, and in there's a small school that we are running with partners. We're running that school, and you ask these girls, what do they want to be? And they want to be lawyers and all kinds of things. The fact is that half of those girls will be pregnant before they are 15. Mm. But they haven't seen that yet, and they're still hoping that there's a future out there. And that's why it's so inspiring to work with children, mm-hmm. because they force you to think there is hope, mm-hmm. but they also force you to think that this is a matter of urgency. A child cannot wait for months, for years, for a change to happen. And that's why to work with children, create a future for them, that's a very, very good place to start.
Thank you, thank you. So. So, Florian, I'm a physician, and your talk was very medically oriented. You talked about all the health problems that MSF treats, and both the physical trauma and the psychological trauma. But it's interesting. You started your talk by saying that this crisis is being driven by restrictive entry policies, that we're preventing people from getting to safer places legally, so they do it illegally. How do we move to less restrictive policies? How do we create that change?
Okay, that's a dangerous question for me to answer because obviously I'm not a politician and don't represent any kind of political interest group. But maybe just to connect a little bit to what you were just saying, I think there are some very, very straightforward and easy policy solutions. For example, why not promote accelerated family reunification between those children sitting in a camp in Greece and their parents, many of whom are already in Germany or Sweden or wherever. It's not always rocket science, to be honest. You just have to want to do it, and I think that's going to be the core of my answer. It is about political will. And while I fully agree with Ambassador Swing's observations concerning xenophobia, and the kind of, the sort of political, the dialogue that we're hearing a lot, and the fact that many politicians seem to be more intent on playing on these fears rather than to actually look for solutions. I think we should not forget that the crisis in Europe in 2015 and this year also has shown us that there are many, many Europeans who think very differently about these issues, that there are people right now who give up their holidays, sometimes their careers, to go and help in the jungle in Calais, that there have been people in Idomeni at the beginning of this year who were not people hired by an aid organization like MSF, but who out of their own volition and their own initiative actually made sure to help people arriving inside Europe. So what I think, to be honest, and I'm not very optimistic, I have to be quite frank, as far as Europe is concerned. But I think the only solution, if there is indeed going to be one, has got to come from civil society and from public opinion. Because I think what we've been hearing a lot about is public opinion that is extremely critical of people arriving in Europe, sometimes outright racist. And I'm not denying that that exists, it does. But it's not the only thing around. So our governments are most likely not going to move on these points unless they feel that there's significant political pressure on them to do so, and unless there's also political leadership that says, yes, I will take that risk, I will show the political will necessary to do things which may actually not go down that well with a part of my electorate.
So I agree. One of the most remarkable things that's happened in the U.S. over the last decade is the acceptance of gay marriage, where we went from a situation where the majority of the population was against it, and then we had a very rapid change. And it was done because people humanized the issue, just the point you made, that instead of it being a biblical issue or a moral issue, they humanized it and pointed out that everyone knew gay people. Gay people were our brothers and sisters and fathers and mothers, and so that by humanizing it, we were able to make that change. And I would just, that goes to your point, Yves, about the numbers are people. One of the things that you spoke about was this targeting of healthcare workers and healthcare facilities. Several speakers spoke about it. And especially in Syria, it's just incredible what's happened there. Well, many governments bear blame for this. The U.S., as you know, had a campaign where they had polio vaccinated, where they had people looking for Osama bin Laden masquerade as polio vaccinators. That led to the death subsequently of many polio vaccinators. We've gotten an agreement from President Obama to never ever have covert operations masquerade as health operations in the future. But this is not that. This is where people are trying to hurt the population, governments, by targeting healthcare facilities and killing healthcare workers. This is a difficult issue. How do we create change there?
I think, first of all, let's recognize that always in conflict, you had health facilities, doctors, nurses, which were hit. What is new over the last few years is now it is much more strategically thought through by the parties to the conflict, government, but can I say sadly also non-state armed group, the same. And the first thing you do when you do war is really to target, in fact, the health system and the people related to health. Because what you do, you send a very strong message to the other side that whatever happens, you won't be able to treat your family, your children, and you make sure that hospital becomes the place which is the most dangerous place to go. Today, the last place people in Aleppo, but not only in Aleppo, in Homs, in Idlib, in Yemen, in South Sudan, the last place where you will go is hospitals or medical facilities, because it's a very risky place to go, because it's targeted. We have here with us Florian Westphal from MSF. MSF, they have got several hospitals targeted. Remember Kunduz a year ago, right? Targeted at the time also by government airstrikes. So I think there is something which is an enormous trend, and I think we need to be very careful. So what can we do? I think there is a lot to be done with, in fact, states to start with that. I think we here to have to find a collective solution. There is at least one element in terms of diplomatic, I would say, politics. We managed to have a resolution from the Security Council in May. You can say, these days, the Security Council, but at least we had everybody agree to have a resolutions on protecting health worker in conflict situation. That's something. But we have to go at least 2 steps further. One, we need to make sure that in every country you have within national legislation and regulation clear rules who clearly state what needs to happen when a doctor is protected or not. I just insist on that one to give you a sense. In a country like in Syria, there is legislation who says as a doctor, if you treat an enemy wounded, you can be tried as a traitor. This is unbelievable. So we need to make sure that national legislation is really respected. But then the point is also then to you, ladies and gentlemen, and to health professionals, to health policy thinking. You have to make sure that whatever we do, if I just think on the global health security agenda, which is a very important agenda, which is pushing the critical issues when it comes to look at system, trying to avoid to have new infectious disease like Ebola, raising again. You have to integrate in your policy, in your international health regulation, the fact that protection of health workers on health facilities should be at the center of your policies. And not just a side issue. Because what will happen is if there is a push everywhere, at the top level, but also at the policy level, if communities of concern like you, at the academic level, at professional, are mobilized and you're pushing, it will make a difference. And I would argue this is possibly one of the biggest issues, because if we don't manage to have humanity, really at the core of conflict or situation dramatic, it will continue to be very, very difficult.
Well, that's a wise and insightful answer. I think the idea of making the argument that it's important to preserve health care for the selfish reason of protecting your own health, your own country's health, right? Which is the same issue, even for countries that haven't been willing to give aid, the notion that we have to maintain health in other countries because it comes here. That's the argument you're making there, besides the moral argument.
I think so, and I think there is one good news, which is I think health it's not new, but health is really at the core of the agenda, right? My only problem is I see health at the core of the agenda of the politician, normally when it's related to three issues. One, it's when it starts to be too expensive, so people are start to be nervous. B, when it starts to hit, trade and then security, right? We see that with Ebola, right? And three, when of course in terms of, let's say, it starts to shake the public opinion, and then you have an interest. I think it's time to be more proactive. And here I'm really looking at I do understand politicians. They have to live in a very, very complex environment where, in fact, the space to think about new solutions, collective solution is difficult. But we have a role to play. You have a role to play. I found, for example, that the academic network, university, you might be the only place these days where you can build multi-stakeholders, multidisciplinary, complex solutions when it comes to migration, when it comes to health. I would like to hear you more. I would like you to really own it and push it. You can make a difference, really.
Yeah. Good. Well, I think for many things, universities, if they decide to act, can be the trusted partner, the stakeholder, impartial stakeholder who can bring people together. I think we've seen that for a number of issues.
I'm convinced, and I'm also convinced that we're going through a time, and Ambassador Swing was talking about that, where you have such a level of polarization these days that it's extremely difficult to build collective solutions. Consensus is becoming a very rare commodity, and trust too, by the way. I feel that university have still the power, the space to develop solutions which are not always time-bound and media-bound, and maybe to develop complex solutions. If I talk about migration 1 minute, I would find fantastic to discuss as issue, how can we allow migrants to have temporary, not only protection, but identity? How do we manage that they are having with them data which can be protected and will help all of us to be able to do a release continuous of health? I mean, all these questions won't be solved by government. They don't have the time. They won't be in a situation to be able to do. Yep. University could do that together.
Okay. So that's one charge to those of us in the room from academia. Let me ask the other speakers, as we've got a large group here, very influential people, what would be your charge? What would be your advice for what we do from this day forward to improve the situation that's so bleak and in many ways depressing? So Bill, maybe I'll start with you.
Well, I've sort of exhausted, I think, the last thing. I'll be shorter on this one. Look, I think that we've got to decide whether we are at a defining moment, or are we simply in the midst of a long, dark tunnel, the end of which we cannot yet see any light. This could be a defining moment. If we can have rules and regulations for the free flow of capital, goods, and services, it would be logical to conclude that we need some kind of understandings about the free movement of people which make all of this happen. And I'm not talking about open borders. Let me be very clear, particularly here in a country for which I have enormous regard. We're not talking that, but we are talking about getting back to some more basic understandings, first of all, as to why people move, why it's necessary they move. We have a very simple thesis at IOM. It is, first of all, that given the driving forces that we know about, large-scale migration is inevitable for I don't know what the foreseeable future means, but certainly for some time to come. It's not only the demography moving it, it's the disasters I mentioned from West Africa to South Asia. It is the demand for labor if we're going to have flourishing economies. It's the digital revolution, 300 million people connected to the internet in the year 2000, Today, well beyond 3 billion, heading toward 4. If Mark Zuckerberg gets his way, it'll soon be 7 billion. It is distance shrinking technology. It's what we call desperation migration, which was well described by our colleagues here on the panel, where people say, I'm willing to take a risk of dying because staying where I am is worse than death. It is all of that. It's the degradation of the environment with now what we can call climate migrants. I spoke to former President Tong in Kiribati in the Pacific. He has 39 atolls there. He's buying land in Fiji for his people because you'll have a new form of statelessness called, the state didn't reject me, I lost the state physically. So all of this is happening there. Secondly, not only inevitable, it's necessary if we're going to have flourishing economies. Thirdly, it's highly desirable if we come up with the right policies, which have to do more legal avenues of migration, more protective possibilities for people on the move, lots of other things, multiple entry visas. In 2013, Europe said, you know, we had 300,000 people came north. In point of fact, there were more people who overstayed their visa than came by boat because they had a single entry visa. So we have multiple personalities, multiple identities. People can be very much integrated into the European economy or the US economy or wherever and still be active members of the diaspora. You can have several nationalities. In my family, we have 4 already, just my immediate family. So simple things. Multiple nationalities. Why not? This is a new world we're in now. So, in the end, the thesis that I leave with you is that, and I know you've heard it before, but it's worth repeating, large-scale migration is not an issue to be solved. It is a human reality that we have to manage. And management means good management practices, some of which I've just named.
So if I could summarize, you're saying whether it's a critical moment or not, make it a critical moment. Exactly. Yeah, good, okay. So, Florian, so what would you say to the multi-stakeholder group?
I think it is a critical moment too, and I think if I just expand my focus a little bit outwards from Europe, I think at this moment what's really critical is that I believe that the actual right to seek safety and protection outside your country of origin and residence is being challenged. It's under threat, and that's at the core of the whole protective regime that concerns refugees. And if you know, again, we as multiple stakeholders, as part of civil society, we don't make a concerted effort to tackle this, I think we will see it continuously eroded, because we're seeing that around the world right now. It's not just in Europe, we're seeing it with Australia, seeing it in Southeast Asia with the Rohingya people of Myanmar, to give another example. I think the other thing, I just want to draw back again on something Yves Dacot said earlier, that there clearly needs to be a humanitarian response, and there's lots all of us who are active in that, including MSF, have to do to still get a lot better, especially to respond also to the real needs of people who are on the move. That's what we struggle with, that people don't stay, they move. We don't find it easy to adapt our support to that. But at the end of the day, these people, the real help that's going to come to them is going to come as a result of political decisions. And at the moment, many of those political decisions are not going towards helping those people, they're going towards keeping these people out. And that's the problem that has to be tackled, including from the people who are with us today.
Thank you. So Yves, your advice, your charge?
Embrace complexity. We know migration is a very complex issue, and my message to you and my ask would be that take the time to try to understand a little bit. Go slightly beyond numbers. Try to see the person if you can, but also try to understand what we are talking about. Don't be an expert, that's not what I'm saying, but try to get it through, in fact, your expertise. One example, you mentioned camps, but we know that today, internally displaced people are living much more in host community than in camps. Mm-hmm. So typically you would have, when you think refugee, migrant, you do have to focus also on communities. You have to think, what is the social fabric which is able to absorb somewhat the migrant? We have to focus on country of origin and understand some of the issues. So I think my message to you is, take the time, if you can, to just somewhat embrace complexity and don't be afraid by the complexity. That's one. The second one, in terms of acting, when we talk about migration, health, I think it's very clear that it's a political solution with a collective support. I think there is an issue having, of course, at level of international level, at national level, we have to have political solutions, but with a strong push from academia, from civil society, from professionals, and it will help, I think, to find solutions. Because my experience, and LA will tell us that even more so, is politicians will also react if there are pressure, if there is something happening, and not just, dynamic, which will only are negative. So I think if we are proposing collective solutions, if we mobilize ourselves, if we start to make some concrete proposal, I think political commitment will I think, help us to move in the right direction. And we can make it. Mm-hmm. It's too easy to say, government don't take decision, so myself, I don't do anything. No, we can. We can really do it.
Thank you. So, Hella?
Well, I could speak for a very long time because I'm intrigued by this notion that political leaders are not taking responsibility, and they are. I think we have, first of all, we have the political leaders that can get elected, and we also have tremendous responsibility in Europe right now. We have political leaders who have taken responsibility. Just look at the country we are in right now. We have political leaders that are also challenging development aid to countries that need it. And I believe that we should speak up to those leaders, demand more of them, and also demand more development to the countries where people are migrating from. Mm-hmm. Because I believe that migrating or fleeing from a country or being displaced have many different reasons. But there's no doubt that if people see a daily life where they can have a livelihood, they can have access to education, they can have access to quality health care, they will not find the need to venture into very dangerous journeys across half of Africa to end up in a boat trying to cross the Mediterranean. So I still believe that European leaders and other leaders should look into development of these countries. I believe that is part of the answer. But the last thing I want to say to you, and leave you with perhaps, is that it's very easy to listen to these conversations and leave that door completely downcast of what we can be doing together. But I want to remind everyone that we have before in the world had goals where we have achieved a lot. The world we see today see children that are healthier, wealthier, and better educated than ever before. And that is because we have together created a better world. And it was that notion that we should go for the next years. We have sustainable development goals. We have promised these children and the people that we will make a difference. And I still believe that with the united forces of people sitting up here, with you people sitting here, there is a way to create a better world, step by step, and I believe that the global health community can play a huge role in that. So don't give up. Join us in trying to change the lives of children and create a healthier world for people and children. Thank you very much.
Thank you. So you started your talk talking about the example in 1951 of feeding hungry children in Europe, and I think. Oh, yeah, yeah. But the...
We started 1990 feeding, trying to help children.
Sure, but you were... And so... and we look back with pride on that. And the question is, in 100 years, will we look back with pride on what we did now and how we acted now? And hopefully we will.
We wouldn't now. We wouldn't now look back at the European reaction to the refugee situation and be proud of what we have been doing. But there is still hope that we can do the right thing. Yes. If we speak up to leaders, if we demand something of leaders, if we remind each other of the compassion that is still what we have and share in Europe, where I'm from myself. There is that compassion, and we have to speak up to people, speak up to leaders, and ask them to take us on that journey. And I feel in this room there's a focus, there's a willingness to go along and work together, and I still have to hope and believe that we can do that together.
And history teaches us it's the right thing to do. Yeah. So, well, I want to thank our panelists. I cannot imagine a more informed or articulate group. Thank you for sharing with us today, and I want to thank everybody who came. And please join me one last time in thanking our panelists.